Hello and thank you for joining us. This video will show you an example of the general steps for cleaning a contact isolation room for a daily clean process. That incorporates important healthcare infection control principles. Your facility's floor plan may be different, so review your facility's process. There are additional infection control resources in the video description and on our website, sdhai.org. Environmental services, whom we call EVS staff, are critical members of the infection prevention team. The cleaning and disinfection that you do is an important part of stopping the spread of germs and keeping our residents safe and healthy. For the purpose of this video, the EVS staff will be demonstrating the cleaning process of a room in which the resident is on contact precautions. Notice the sign on the door says contact precautions, which requires all staff to put on a gown and gloves prior to entering the room. When you are ready to enter the room, start by cleaning your hands with your facility's alcohol-based hand sanitizer. Use enough hand sanitizer to allow you to cover all surfaces of your hands and rub for at least 20 seconds until dry. Next, put on a gown, tying it in the back and ensuring it is snug against your body. Knock on the door to introduce yourself. EVS, do you mind if I come and clean your room? As you enter, do a quick scan of the room. Note any items with visible damage that needs to be reported to maintenance for repair. Starting in the back of the room, collect all the trash bags, making sure not to touch the bags against your gown. Discard them directly into the trash bin. Do not allow them to touch the cart in any way to keep the cart from getting dirty. Important to remember, anytime you return to the cart, you will need to take off your gloves, clean your hands with sanitizer, and put on new gloves before touching the cart. This will help keep germs from spreading to your cart. Pick up as many of the new trash bags as needed for the room. Place new trash bags in each of the trash cans. Again, take off your gloves, clean your hands with sanitizer, and put on a new pair of gloves to get ready for the next step. Organizing your trips to eliminate multiple returns to the cart decreases the number of times that is needed for changing gloves and cleaning hands. Soaking the microfiber cloths is the preferred method of applying the disinfectant. Another method is using ready-to-use disinfectant wipes. Both methods provide even coverage of the disinfectant solution and provides better air quality than using a spray bottle. Gather up the number of soaked microfiber cloths or disinfectant wipes that are needed to make sure you can keep all the surfaces in the room wet for the recommended contact time. The contact time is the number of minutes needed to keep the surface wet to kill the germs. Know what disinfectant your facility is using, since contact time varies for each disinfectant. If you do not know the contact time for the disinfectants you are using, reach out to your supervisor or infection preventionist. The room is divided into 3 zones. Zone 1 is the high-touch surfaces in the outer areas of the room, like shared equipment and common surfaces. If there is more than one bed in the room, treat each bed area separately as its own bed. Zone 2 is the area around the bed. Finally, Zone 3 is the bed. The bathroom is cleaned separately, which is addressed later in this video. Place the microfiber cloths around the room in each zone. Remember the cleaning principles. Work from clean to dirty areas. Change the microfiber cloth when it is no longer able to keep the surface saturated for the contact time, or you are moving from one zone to another. Begin in Zone 1. Start with the outer areas of the room and moving around the room in an orderly manner. Make sure to clean all the high-touch surfaces, such as the closet handles, hand sanitizer dispensers, light switches, interior-exterior doorknobs, personal protective equipment, or PPE caddies hanging on the door. Once Zone 1 has been completed, place the used microfiber cloths in a collection bag, which can be tied to the side of the cart. Avoid touching the outside of the cart or bag. Zone 2 is next. This zone is the area around the bed, but not the bed itself. Clean items such as bedside table and knobs, any remotes, telephone, nightstand and knobs. The bedside table is a high-touch surface which the resident and staff have contact with throughout the day. Ask the resident about moving their belongings in order to clean their bedside table. The bedside table is important to clean and reduce the germs. In addition to cleaning the top, be sure to also clean the table's edges and underneath where people frequently touch. Then discard the used cloth in the collection bag. Zone 3. The bed is considered to have the most germs because this is where the resident spends most of their time, and that is why this zone is cleaned last. Picking up a new cloth, start at the headboard of the bed and clean it from top to bottom. Then move to the closest side rail and clean it, including any attached high-touch items like the bed remote. Move to the other side to clean the rail and any attached high-touch items on that side, like the call bell. Finish the bed area by cleaning the footboard. Once you have finished with Zone 3, place the used cloths in a collection bag, remove your gloves, and clean your hands with sanitizer. This resident bed area is now complete. Repeat the same process for multiple bed areas, making sure to clean hands and change gloves as before. The bathroom area is next. Start by putting on a new pair of gloves and gather all supplies you will need to clean a bathroom. Just like the resident area, the bathroom is divided into zones. Zone 1 is the high-touch areas such as door handle, light switches, handrails, and shower area. Zone 2 is the sink area, and Zone 3 is the toilet area. The microfiber cloths are placed around the bathroom in different zones, in areas such as sink, handrail, and on top of the toilet. Now apply the toilet cleaner into the bowl and return it to the cart. Please note, if you set the cleaner bottle down on any surface, it will need to be cleaned before placing it back on the EVS cart. Starting with bathroom zone 1, clean areas such as doorknob, towel rack, soap dispenser, light switch, and handrail. In this facility, the shower area would also be cleaned in zone 1. Zones may be slightly different dependent on your facility layout. Check with your supervisor and infection preventionist for further instructions. Place the used cloths in the collection bag. Now it's time for Zone 2, which is the mirror and sink area. Use the cloth by first cleaning the mirror, then clean the sink handles, next the outer edges of the sink, and finally the sink bowl. Place the used cloth in the collection bag. Now it's time for Zone 3. From top to bottom, start at the top of the toilet, moving down to the seat. Next, open the seat lid, clean the underside of the seat, then clean the rim, continuing with the outer body of the toilet. Last, scrub inside of the toilet. Place the used cloth in the collection bag. Ideally, the toilet brush is located next to the toilet. However, if stored on the cart, store it at the bottom of the cart away from other items to eliminate contamination. When you are done with the toilet, take off your gloves and clean your hands and put on new gloves. The final area to clean is the floor. Gather your equipment, wet floor sign, mop handle, and enough pre-soaked microfiber pads to keep the floor wet during mopping. After placing the wet floor sign in the doorway, pre-place the microfiber pads in each bed areas and bathroom before mopping. Begin mopping from the back of the room, working your way to the front of the room, and include the bathroom along the way. To prevent cross-contamination, avoid retracing the mop path. Use a figure 8 motion as you are mopping to collect and pull debris towards you at the same time. Once you are finished with each section, change out the mop head, leaving the soil mop head at the entrance of the room. Once mopping is completed, remove the final mop head and lean mop handle against the door frame. Pick up the used microfiber pads and place them in the collection bag. Once again, take off your gloves, clean your hands, and put on new gloves for the cleanup stage. Start with scooping up any debris at the doorway collected during mopping. Use a new soaked microfiber cloth to disinfect items before placing them back on the cart, such as mop or broom handle. Then remove your gloves and clean your hands with sanitizer. Remove your gown, Start by untying at the neck, then untie the back tie. Important not to touch the front of the gown or sleeves with your hands. Remove the gown from your arms by placing your hands under the wrist cuff and pulling the sleeve over your hand. Then pull the gown off by rolling it inside out into a ball to throw away. Clean your hands with sanitizer again. Congratulations! This room has been cleaned. If you would like additional infection control resources, please see the video description below or reach out to us at our website, sdhai.org. Thank you for watching us. We hope this video was informative and highlights the important steps in a daily clean of a contact isolation room using infection control principles.